Hello and welcome to NCTV episode 64, which is all about tennis elbow and how you can prevent or treat it. So Wimbledon season is now upon us at the time of recording, having started earlier this week, so tennis elbow seems an appropriate theme. Despite the name of it, tennis elbow is not just a problem incurred exclusively for tennis players, and in fact I see more clients in clinic who suffer from tennis elbow from activities unrelated to tennis. However, saying that, it is obviously a common injury for tennis players and one that requires assistance regardless of how it came about. So a little bit about tennis elbow. If you have it, you may experience pain when performing gripping tasks or when bending the wrist or fingers backwards against resistance. Pain can also be present in your forearm muscles when they're stretched out, particularly if you're bending your wrist forwards with your elbow straight out in front of you. There's also usually tenderness directly over the bony bump on the outside of the elbow and tender points on the outer forearm muscles. In some cases, you may also experience neck stiffness and tenderness, and possibly also signs of nerve irritation like numbness and tingling. The cause of tennis elbow is mostly down to repetitive gripping actions, meaning it could stem from a number of activities such as using scissors, cutting meat, carrying grocery bags, gardening, manual work that involves repetitive turning or lifting of the wrist, such as plumbing or bricklaying, and even typing. In acute cases, which are those with recent onset, this is known as lateral epicondylitis, and it's associated with pain and inflammation at the point of the elbow where the outer forearm tendons attached to the bone occurring when more force is applied to that area than the normal healthy tissue can handle. This might be from performing an unaccustomed heavy, sort of hand-heavy activity such as tennis or DIY, particularly if you spend a long time doing it when you're not used to that activity, or if you generally have weak forearm muscles or are gripping too hard or have poor technique. Chronic cases are those that are more longer term but don't involve inflammation and are instead associated with degeneration of the tendon, and the changes occur to its blood supply and nerve supply. Unfortunately, rest as a treatment isn't actually very helpful in this situation, and if left untreated, tennis elbow can last anything from 6 months to 2 years, and it can have a serious effect on your sport, daily activities and work. The good news is though, through physical therapy, this can effectively help with both the acute and chronic cases of it. And there are several things that you can do to help in recovery and prevention. Physical or manual therapy can help relieve the pain by releasing the soft tissue tension with massage, stretching the tight muscles and structures, and mobilizing the joints of the elbow, neck and shoulder to ensure normal function. Additionally, other treatments that have proven to be effective are the application of ice, ultrasound therapy, taping or the use of a tennis elbow support, dry needling, and exercises to strengthen and balance the relevant muscles. If all this fails, then as a last resort, a type of surgery called subcutaneous tenotomy can be performed, which has a 95% success rate with no consequential reduction in grip strength. Ultimately though, you need to find the root cause of the problem and prevent tennis elbow from occurring or recurring, which unfortunately it has a tendency to do, and that's where the likes of your friendly local osteopath comes in helpful. If we're being specific to tennis, then modifications to the equipment can help, such as using a lighter racket or one with a more flexible shaft, increase the racket grip size, use string vibration dampeners, reduce string tension, increase the racket head size, play with newer balls and don't play with wet balls, and use softer grip material. Aside from tennis though, changes to the relevant tools and work equipment can be helpful too. Remember to always increase your workload or tennis time gradually allowing your muscles time to adapt to the new demand. Finally, make sure you condition your muscles and arm with specific exercises, and this will go a long way to playing pain-free tennis or performing whatever job it is that you want or need to do. So that's it for this week's bite-sized bit to help you have flourish, and I'll see you again next time. Bye for now.